52-year-old male here with what sounds like cubital tunnel of the right elbow. Here we're going to go over anatomy of the ulnar nerve as it approaches the elbow. Here again we're focusing on the medial posterior elbow. We can see the ulnar nerve crosses under the arcade of Struthers, which is translucent here. Now we're making it more opaque. And then it passes under the Osborn fascia, and then under the arcuate ligament, which essentially bridges the two heads of the flexor carpio-ulnaris muscle. Now we're making the flexor carpio-ulnaris muscle translucent, and we're going distally, and we're following the course of the ulnar nerve as it passes over the transverse carpal ligament, and then it branches off into the deep and superficial branches. Now we're going proximal again, and we're showing this patient that has an enlarged ulnar nerve, both proximal and underneath Osborn fascia. And then as you go distally under the arcuate ligament, it gets thinned out as it gets pinched in that region, consistent with the patient's cubital tunnel syndrome. And again, here you can see how the ulnar nerve is swollen proximal and underneath the Osborn fascia, and then as you go distal under the arcuate ligament, it gets pinched or thinned out, consistent with his cubital tunnel syndrome. Here you can see this enlarged ulnar nerve under the Osborn fascia. It's oblong and irregular in shape. Also, you can see the posterior bundle of the ulnar collateral ligament underneath it as well. Here again is the ulnar nerve going distally underneath the arcuate ligament. You can see the two heads of the flexor carpio-ulnaris muscle. And as you go distally, the ulnar nerve actually becomes hyperechoic relative to the surrounding musculature, and here you can see it underneath the flexor carpio-ulnaris muscle. We're going further distal, and again the nerve is becoming more hyperechoic as it's surrounded by the hypoechoic musculature. Just 3, we're going distal to proximal now. Here we're just following the nerve proximally towards the elbow, and you can see how it becomes thickened and irregular in shape, consistent with this patient's cubital tunnel syndrome. You can see how the ulnar nerve sits on top of the posterior bundle of the ulnar collateral ligament. Here's the nerve in long axis at 1043. Here the ulnar nerve is thickened proximal to the cubital tunnel, consistent with his cubital tunnel syndrome, and it gets thin as it gets pinched within the cubital tunnel. Before you see that ulnar nerve, we're kind of rolling over it. Here again, the ulnar nerve is thin as it's underneath the arcuate ligament, and as you go proximal, it becomes more globular and thickened, consistent with his cubital tunnel syndrome. Let's try to compare it to the other nerve. And here's the left side. You can see the ulnar nerve definitely looks smaller on this. Here, the ulnar nerve has a more rounded, regular type shape, and I believe it's a little bit smaller as compared to the other side. Here we're going distal, and you can see the arcuate ligament over the ulnar nerve. And now you're starting to see those two heads of the flexor carpio-ulnaris muscle come into play. You can see the ulnar nerve underneath those two muscle heads. And now we're just going distally. See how the nerve is traveling deep. And again, you can see how the nerve has that honeycomb texture, and it's hyperechoic relative to the surrounding musculature. Now I'm going to turn on this one also. At 1048, we're going to try to go long axis to it. So here you can see the ulnar nerve in a sagittal plane or long axis to the ulnar nerve, and it's fairly constant in its diameter. Looking at the ulnar nerve, right side of the screen is proximal, and we're kind of scrolling over it. It looks pretty uniform in thickness. So here we're seeing the ulnar nerve in segments, and it's uniform in diameter, which again is different than his affected side.